Hi, my name is Alissa Schick, and today I'm conducting an instructional video on how to perform a lumbar assessment on a post-operative scoliosis patient. This video is intended for new graduate nurses that will be working in an acute care setting on an ortho, medical surgical, or neuro floor. Let's meet our class. So today, we are going to be teaching Melissa and Ashley. Melissa is a new graduate nurse going to be working in a medical surgical intensive care unit, and Ashley is a physical therapist. They both will be caring for post-operative scoliosis spine patients. So let's let you know just a little bit about scoliosis. So scoliosis is a three-dimensional deformity that affects the frontal curve of the spine and affects the balance between the front and the back. Scoliosis is prevalent in the adult population of 2 to 32%. Now, Melissa and Ashley, if scoliosis is left untreated, it can cause severe deformity, cardiopulmonary complications, and severe back pain. One way to correct severe scoliosis is through corrective surgery, where they correct the curve of the spine through spinal fusion and is indicated for adults with curves greater than 50 degrees. However, Melissa and Ashley, adult scoliosis corrective surgery may have large complications post-operatively. Some of those complications can be neurological deficits, pulmonary embolus, or dural tears. Therefore, performing a thorough lumbar assessment post-operatively on a scoliosis patient is essential. So we're going to begin our lumbar assessment. So we will be assessing the lower extremities of the patient. The first thing we're going to go over is the power grading. Power grading is assessing the muscle strength and the ability of the patient to move their lower extremities. So Melissa and Ashley, this is Stephanie. She is going to be our patient today and whom we're going to be doing the lumbar assessment on. So if Stephanie is unable to move her lower extremity and we note no muscle contraction, we would give her a score of 0 on a scale of 0 to 5. If we see that she has some muscle contraction but is still unable to move her extremity, we will give her a grade of 1. We will score her muscle contraction 2 if she has active movement, but I would eliminate gravity for her. A score of 3 would indicate Stephanie is able to move her own extremity on her own with gravity eliminated. A score of 4 would be Stephanie's able to move her extremity against gravity and against some resistance, but I am noting that it is weak. A score of 5 would be Stephanie is able to move her extremity with normal power and against resistance. Okay, so here we go. We're going to start with the hip flexor. Now the hip flexor, I'm going to ask Stephanie to bring her knee towards her head. Again, I'm assessing for strength to make sure it's a 5 out of 5 or rating it on my scale 0 to 5. I'm also going to be assessing if she has normal sensation, and the sensation distribution would be at L1 and L3, which would be the upper part of her thigh. We will then move on. We will do that on both legs. You want to make sure that you do it bilaterally as well. Our next section is hip adduction. I will ask Stephanie to push her knees together. Again, I'm assessing for strength on my 0 to 5 scale, and I'm making sure that she has normal sensation. Do you have normal sensation? Especially at the L2 level, which is the upper anterior thigh, and L4, which is the lower inner part of the leg. Next, we're going to ask her to do hip adduction, where I'm going to ask her to push her knees outward. Again, I'm assessing for strength and assessing for sensory distribution at the L4 medial part of the leg, L5 outer part of the leg, and S1, which is the outer portion of the foot. Next, we will be doing knee extension. I will support Stephanie's knee underneath, and I will ask her to go ahead and bend her knee and kick her leg up. This is the knee extension. Again, I'm assessing for strength, and we're assessing for sensation at the L2 level, upper part of the thigh, and L4 medial part of the leg. Next, we will ask her to dorsiflex her foot. I'm going to have you, Stephanie, go ahead and bring your toes towards your head. Again, assess for strength, and then assess for sensation at the L4 and the L5, outer part of the leg. Next, we will have her do a tibialis anterior foot inversion. Stephanie, I would like you to take your foot and move it inward. Good. Again, I'm assessing for strength. Again, and assessing for sensation, again, at the L5 level. Lastly, we're going to do the plantar flexion, where I will ask Stephanie, please point your toes downward. Again, we assess for strength, and again, we are looking for sensation. At the L5 level, the outer aspect of the leg, S1, the outer portion of the foot, and S2, which would be the posterior portion of the thigh. Make sure that she has normal sensation. The last thing we're going to check for is for clonus and the Babinski reflex. The way that we test for clonus is we pick up Stephanie's foot and we make nice circular motions. We will get her foot to relax. Once her foot relaxes, we will briskly move it up toward her head. If you notice the sustained beats, this is positive for clonus. If there are more than 4 beats, we need to notify the physician. This could mean something is impending on the spinal cord. Next, we're going to test the Babinski reflex. So I will get my tool out of my pocket. We will stroke the bottom of her foot. So I'm going to stroke the bottom of your foot, Stephanie. What I'm looking for is to see if the toes fan. If the toes fan out, this is a positive Babinski, and in adults, this is abnormal and must be notified to the physician immediately. For this could mean that there is damage to the nerve pathways from the spinal cord to the brain. All right, Melissa, now it's your turn. We're going to go over the assessment again.
Okay.
And Ashley, I'll be asking you some questions about the strength as well. So what are we going to begin with? We'll begin with the hip flexor.
Okay, Stephanie, pick your knee up towards your head.
Great. Again, she's assessing for strength, 0 out of 5, and sensory distribution. Where would the sensory distribution be on the hip flexor, Ashley?
L2.
Great. The next one.
Okay, Stephanie, can you push your knees in?
Again, we're doing hip abduction. She's assessing strength and sensation. What's the next one, Ashley?
Hip abduction. Okay.
Great.
Stephanie, push your knees out for me. Very
Perfect.
good.
Great job. What's the next one, Melissa?
That would be the knee extension.
Very good.
Okay, go ahead and kick your foot up.
So as you can see, she continues to support under the knee and she's extending the leg. Great job. What's the next one, Ashley?
Dorsiflexion. Okay, perfect. Can you point your toes back towards your head?
Great job. Very good. And she has equal strength. We're noticing she's nice and strong. And do you have normal sensation? Great. Melissa, what's the next one?
The foot interior inversion.
Very good. So we'll ask Stephanie.
Turn your foot in. Very good.
And what sensation level are we at on this, Ashley?
That's the L5.
Very good. And lastly?
Okay, Stephanie, point your toes down.
So she is assessing the plantar flexion at this point where she's pointing the toes downward. Great job. So Ashley, I'm going to have you test for clonus and test for Babinski.
Okay. So I'm going to make circular motions, have to get the foot to relax, then a brisk, forceful motion back toward the head. And I observe no beats of clonus, so she is intact nerve pathways.
Great job. And I'll have you test the Babinski.
All right, I'll be not forcefully, but briskly touching the side of the foot, the lateral border of the foot, looking for toes fanning.
Very good, which is negative. Great. Great job, guys. Do either of you have any questions?
What should I do if there are 4 beats or less for clonus?
If there are 4 beats or less for clonus, a lot of times if they're immediately post-operative, this is related to anesthesia. However, if you note clonus, it is always a good idea to check with your surgeon and your physician to ensure that that's a normal response. Do you have any other questions?
No.
Great job, guys. All right. Thank you so much for participating with our video today. Thank you.